bipolar disorder, what is happening in your brain? Currently, scientists are looking at the amygdala, this little red dot right here. They believe the amygdala is underdeveloped in bipolar children and overcompensating for its size. It's essentially revving up. The amygdala is in charge of processing memory and emotion, emotional memory, aggression, fear, and regulating emotion. So if the amygdala is overworking, then all of these elements are at a heightened level. So they'll feel more aggression, more fear, and have trouble regulating their emotions. The amygdala is also responsible for sending messages to the hypothalamus, not pictured here, but in this general area. The hypothalamus is associated with fight, flight, food, and sex. This means that if the hypothalamus is being given more signals than in a healthy brain, the child will experience paranoia, anger, and will feel sexually promiscuous. This is especially prevalent in teenagers. Scientists are also looking at the hippocampus, pictured here in green and here in blue. The hippocampus is involved in short-term and long-term memory. This plays into the idea of a branded memory. In bipolar disorder, a branded memory means remembering things much more vividly and being hurt by them repeatedly. So whereas someone who is not suffering might recognize the person who uttered whatever the trigger was young or tired or upset by something else, this would hurt the bipolar person incredibly. It could also continue to hurt them throughout their life, even if it was something said in youth. The hippocampus is also involved in spatial memory, so the layout of a room and sometimes the emotions that go along with that. This would help understand the idea of an environmental trigger, why certain things set off the child, and especially if that is an environmental trigger repeatedly, that would help explain why there's an irregularity. So they believe that the hippocampus is either over or underreacting, so the child can't regulate their mood and are experiencing branded memories. Scientists are also looking at the cerebellum, here in the back of the brain. The cerebellum is involved in fear and pleasure regulation and implicit memory, so emotional memory. There are currently no published studies because all 3 studies have been inconclusive. But I know about them because I interviewed a clinical research manager at Stanford's pediatric bipolar program who gave me some insight into what they're looking at. They're really trying to target the cerebellum because fear and pleasure regulation are big parts of bipolar disorder. So if they can link this, to this disorder, that would give them a lot of insight into what is happening and a better way to treat it. Finally, researchers are looking at the prefrontal cortex here in the front of the brain. The prefrontal cortex is involved in decision-making, personality, and judgment. It also regulates every other part of the brain. So, if the prefrontal cortex is out of whack, that means that decision-making and judgments could be rash, personality might be a little bit off balance, and every other part of the brain that is malfunctioning could actually just be receiving different signals from the prefrontal cortex. Instead of those actual parts being out of whack, it's the prefrontal cortex telling them to either over or under secrete chemicals and hormones. Here we see a PET scan of a normal brain versus a bipolar brain. A PET scan is when scientists use technology to track where the glucose is in the brain, because the more glucose, the harder the brain is working. You can see the reds where the brain is working the hardest, and the darker blues are where the brain is not working that hard. You can see in a bipolar brain that it is both working harder and not as hard in different areas of the brain. Here we can see the prefrontal cortex, the cerebellum, and the amygdala, hippocampus, and hypothalamus are all working significantly harder than the bipolar brain. How do we treat bipolar disorder? The current best way we have is a combination of therapy and medication. There are 3 different types of therapy. The first is individual therapy. Here the child works on recognizing, understanding, and then controlling their moods. They start to talk their feelings out and find an outlet such as writing, drawing, running for their moods. So this would first entail that they need to be able to understand that they are experiencing an emotion, and then learn to transition and remove themselves from the scene and use that outlet to help regulate their moods. Music has also been very effective in controlling moods. So they limit the number of mood-provoking songs songs they can listen to before switching to a happier or calmer music. So this might entail, if the child is experiencing depression, they will get 5 sad songs, and then they have to switch to a happier song. They slowly start to narrow this number down until the child is comfortable using music to neutralize their moods. Lastly, dogs have been very effective. Therapy dogs are trained to sit with a child when he or she cries to help comfort them, and many children find it easier to talk to a dog than a therapist. They'll sit there and stroke the dog's ears and acknowledge how they're feeling and what might have set them off in a safer feeling environment. Next, we have family-focused therapy. This is when the whole family goes together. This is used for kids at high risk for bipolar disorder and children suffering from it. It helps the family understand what is happening and what is going to happen. It also gives the family a psychoeducation on what bipolar disorder is. They often use drawings and games to help the family communicate and understand each other. This helps foster an environment in a less stressful and serious way and learn how to work together and overcome their issues over a mutual activity. This is also helpful because it can be taken home and used when the child is having a hard time. This family-focused therapy is also used to help eliminate environmental triggers, figuring out what sets the child off and what the family can do to help eliminate that influence from their life. This is particularly helpful for siblings of bipolar children who have been known to provoke. This is also a very helpful therapy for the entire family. Bipolar disorder is hard for everyone, not just the child suffering. And so this helps the family understand why things are happening and acknowledge that it's difficult for them as well. There have been several studies recently conducted on family-focused therapy, and all have found it to be very beneficial. Lastly, we have group therapy. This is a new idea started at Ohio State University. This is when children and teens of the same age sit together and share their experience. It helps them to feel heard. They talk about problems they're having socially and figure out ways to work through it together. This is especially helpful because children are often taught to hide the fact that they have bipolar disorder from their friends and maybe even extended family. Parents know that their child might be isolated or estranged from the group. So this is an opportunity for children to sit with other kids and openly talk about the disorder that they all share and ways to overcome it together. There is currently research being done right now to see how a helpful group therapy is, but so far all have found it to be very beneficial. Next, medication. There are 4 main categories of medication: mood stabilizers, antipsychotics, anti-anxieties, and antidepressants. Also any other necessary medications, usually ADHD or stimulant medications. Mood stabilizers are things such as lithium or Lamictal. Depakote is also a fairly common medication. Lithium has been around for quite some time for bipolar disorder, and Lamictal is a newer drug that used to be used for children suffering from epilepsy and was also proved very effective for bipolar disorder. Antipsychotics are used in more severe cases of bipolar disorder, especially if the child is experiencing psychosis. Anti-anxieties are used because often a side effect of other medications is anxiety, and anxiety disorder can be coupled with bipolar disorder. Lastly, antidepressants are used to combat the depression end of bipolar disorder. Recent studies have suggested that antidepressants induce earlier manic episodes. So children who are just taking it for depression are experiencing mania. They're currently researching to see whether or not these manic episodes never would have happened or whether they were just early onset. Once the child has been diagnosed with bipolar disorder, the antidepressants are not any added harm. So how do we choose a medication? It's very difficult because not all medications work for every person, and it takes a fair amount of time to identify which ones are going to work. They usually start by looking at the family history and seeing what has worked in the past. They then look at the current state of the child, so mania, depression, anxiety, and sort of start working there. Lastly, they start with a mood stabilizer, lithium or Lamictal, and then supplement with an antipsychotic if very severe, and any other medications that the child seems to need.